Good afternoon, everyone. Welcome to this month's or this quarter's Pediatric Home Service Staff Meeting. We're happy to have you all on, the largest group we've had before. It's right now you got about 340 dial-inners or people assigned or jumping on the call. So thank you to everyone for taking a few minutes out of your day to join us. We got some good stuff to share with you, some exciting things to talk about, some updates for the company, some celebrations, and all the other things we normally do. Gina, if you could go to the agenda slide. As is typical for our presentation, we will continue to share with you some of the celebrations and announcements that we have. And then we'll dive into some things that we're doing as the company through each of our three pillars of the PHS Way, bringing more care to more kids, efficiency, and being a great place to work. We have today almost a dozen presenters that we'll walk through with you today from different parts of the organization, from supply chain to clinical to IT to HR and a few things in between, and maybe there's finance in there. But we're happy to share some of these updates with you. Again, we're coming to you from this new town hall format, which allows us to cycle the presenters in and out efficiently and allow you to see those groups. So if we can go to the next slide, You're the Reason, this is a great place to work. Before we get into these folks, I just want to share, there's a few things going on in the company, as you know. Today, the San Antonio office is going live on a new phone system as part of our continued integrations. One Texas integration continues. We have 100% of our clinical services staff on Brightree, as we did last time, and now we are more than half of our company is on the same instance of Brightree, so more than less, and which is great as we all kind of start to speak the same language. We have more nurses today than we did last month and we did last year. We continue to grow our nursing population, and that results in more children and more care that we're able to provide on a comprehensive basis, and we'll share some of that with you. We continue to increase our conversations with the payers as we bring about a comprehensive solution to the pediatric population that we serve. We have our new business line with us, our PPEC business, our Prescribed Pediatric Extended Care business, headquartered in our Florida locations in Tampa, with operations in the East Coast and also in the South. We have more referral sources talking to us today than ever before, and there's just a lot going on. And of course, there's other things that we continue to work on. These challenges, of course, in some instances, departure of a major supplier from our ventilation business, which we've been working with our referral sources to replace and find new services there. Better ways to deliver our education service offering as we scale our organization to a larger community. So we continue to work through a lot of operational things, and the people on the next 4 slides are those individuals that have risen to the top. I won't read all of the names, but we'll just continue to cycle through here in just a little bit here. These are the individuals that provided, raised to the top in terms of our pediatric PHS Standing Ovation Awards, our PSO award winners. These, again, are taken from our High Five Awards. We get an opportunity to provide kudos to our teammates. And these are the individuals that receive those and ultimately are selected amongst the cream of the crop, so to speak, that provide those services and whether those all the different work streams that we have. So appreciate all the PSO winners. Again, you've seen them on the screen here, and we can stop here for a minute as we get to victory laps. The victory laps, as we see, this is not just great work. This is trips around the sun with PHS, or trips around the sun with the company. And again, we recognize everybody's initial start date, whether they come from direct hire or they come from an acquisition. And so what you see here is those individuals spent 5 years with us. These are the folks that have stood the test of time and seen a lot of change in the industry, a lot of change, and maybe even the work that they do on a day-to-day basis may have started somewhere else in the organization and have changed their responsibilities in the organization. So to congratulate those to our 5-year winners, on our next page we have 8 individuals who have circled the sun 10 times with us. And again, all of these coming from various places in the organization, not only locations, but also functions as well as responsibilities. Now, as we get to further along in the organization, further along in the tenure here, the numbers dwindle further, but 15 years this year, we have Colton out of our Waco office, Colton Glazer, our branch manager in Waco. Colton started with URS and is now part of the PHS family. And we're happy to have him here with us and celebrating his victory lap. Even more, 20 years, 2 decades with us. If you turn to the next page, there we have Stephen, Jennifer, and Lori. A lot of these names, a lot of people know because they have been in various places throughout the organization or have seen so many kids. The number of children that these individuals have impacted is not a small number. If you think about the thousands of kids that we take care of every day, and the thousands of work streams that happen to take care of those kids, these guys have seen a lot. Now, every time somebody crosses over into beyond 20 years into the 25 mark, we have a special guest speaker, and I'd like to invite Michelle Curley to come on screen and talk to us about our 25-year victory lap.
Thanks, Adam. I've had the pleasure of working with Jill Liebers for the past 19 of her 25 years and here at PHS in Minnesota. She has been instrumental in developing and maintaining our infusion pharmacy. In recent years, she has added leadership to the clinical nutrition department, which really ties together our home parenteral nutrition patient population. She's an advocate for our industry, and she also participates in committees in the National Home Infusion Association. She has great relationships with our vendors and is always working to keep our expenses down. She's a team collaborator and always willing to help resolve issues. She played a major role this last year in the EHR conversion to Care 10 and continues to dig into the challenges we have faced along the way. When she's not at work, she enjoys running and photography and is a proud parent of 2 amazing kids, Noah and Megan. Congrats on your 25 years, Jill.
Congratulations, Jill. Put me back on. Congratulations, Jill. Appreciate all you do for us and your pleasant countenance with not only our children, but also our staff and all you do for us. So again, congratulations. If you see Jill in the hall or even online, give her a high five for us. That's our victory laps. We'll turn now to department recognitions. And as you know, everybody in the organization, all of our different departments have their own special day. And we celebrate those. And in this coming quarter, you can expect celebrations around our complex rehab team, our IT department, our HR department and compliance. A lot of our enterprise support services here in the coming month in September is a big enterprise support services thing as we gear up for later in the year when we do have our home health month. So again, look forward to, if you're in each of these departments, you'll get some special recognition, and we look forward to sharing that with you as we do all of our teams. Our next slide here, I'd like to show you a couple of new and interesting things. Obviously, we love who we are. We like to represent ourselves as we do every day. But we've added some additional new apparel to the PHS store. Worked with our marketing team, who've come up with some fun new ways, some fun new logos to represent who we are. Provide some additional ways to say, hey, I'm from PHS and this is who we are. So feel free to jump to the company store. Obviously, when we do our departmental celebrations, you did get a code to the company store. We'll keep those up for the next year. These up for the next year or so or beyond. But we appreciate the marketing team and our talented graphic design individuals that help us kind of keep our brand going and find new and interesting ways to celebrate it. So I look forward to seeing some of you in these graphic representations of what we do every single day. You see there on that gray one on the slide says I make a difference, and all of you do. So those are our celebrations. Again, we'll jump now to company performance. We'll pause here to allow Drew to come on to share some thoughts about the performance of the company from a financial basis. But as he's getting ready, I'll just share with you some things here operationally. As I mentioned, we are caring for more kids today than we were last year. Significantly more children are under the care of our services. We have 1,500 employees that are making a difference in the lives of the families and the children every single day. Everybody is working toward that vision of more care to more kids. But I'll turn it to Drew to kind of see how that is marked out in our both our comparison to where we were last year and where we are to expectations to our plans. Go ahead, Drew.
Yeah, good afternoon. Happy to be in Clearwater, Florida with the All About Pediatrics team. So thank you for hosting me here today. And after I had a nice meeting this morning with Pediatric Health Choice over in Tampa. So it's been a good tour of Florida so far. I am excited to talk to you about the financial performance of the business. Overall, the company continues to perform very well versus budget and, year over year. We're going to look at a couple of slides here. You can go ahead and advance to the next one. And this is our year over year revenue growth. And you can see that year over year, our overall business is growing 15%. That's the box on the left. Our clinical services, which if you think about that, is our respiratory, our enteral, pretty much our non-IV and our non-PDN business, that's growing 16%. The IV enterprise or the IV business is growing about 12% year over year, and that's driven both by Upper Midwest and by our Houston. Our Houston market and IV continues to ramp, so we're very excited about that. The PDN business is trailing year over year growth a little bit, but that belies the steady growth we've been seeing recently as hours and admissions continue to grow. And that's a result of the hard work and leadership and the pivot that the PDN leadership, both senior level and the branch market level, have done. So we'll continue to see this gap on the PDN revenue year over year shrink as the year progresses, and we're very excited about what we're seeing in regards to admissions, more hours, and overall, this is a good reflection of the reception and the proof of our overall strategy of getting more kids home faster, keeping them home longer, using our comprehensive care strategy, where we can to keep them home longer and to keep them on service longer and save everybody money and just, really provide the right outcome, the best outcome for these kids. We don't want to be in a hospital. The kids don't want to be in a hospital. Let's get them home. Let's keep them home. And we're doing a great job of that. And it's proven in our financial performance, especially our year over year revenue growth. I want to go to the next slide where we can talk about just our earnings versus budget, which again is a great story. We're just a little bit under 2% ahead of plan for the year. Again, that's the box on the left there. So we show 101.6%. And so we're about 1.6% favorable to our budget. You can see our clinical services business is 6%. Enterprise or IV, I'm going to do that every time, I guess. But the IV business is actually 17, almost 18%. And the PDN business is about 28% favorable to budget for the year. So very exciting results we're seeing, I think you're actually going to see this improve based on what we're seeing in July. So if we were to float this out after we finish July, I think you would see us even stronger versus plan. Again, this is a credit to all the work that's being done, whether it's in Clearwater, Florida, Tampa, Florida, whether it's being done in Columbus or Cleveland or Minneapolis, Milwaukee, or the Texas locations. Y'all are doing a great job getting these kids home faster, keeping them on service longer, and just making a better outcome for everybody. We're doing well by doing good, and our financials are proving that out.
Great. Thank you, Drew. Thanks, Drew. I appreciate the update there. We enjoy sharing that with you. If we can turn to now more care to more kids, I guess some other updates on our growth of our organization. One of the things that we would that we continue to do is focus on how can we, if we believe, and we do, have the best model, and we have information to show that we do here. And I'm going to share that with you in a minute. The goal is to share that with more kids. We shouldn't be resting until we have every child home with their families. Is the big goal here? Bring those kids home sooner and keep them home longer. We believe every child deserves to be at home where it's medically appropriate. One of the things that we can do is increase our messaging around that. And increase our presence and make it easier for the families and for the referral sources and everybody that interacts with us to be able to take that step to work with PHS. And so the next slide, I'd like to share with you a little bit of an update. You'll see coming at the end of September, a new website for PHS. We're still PHS, still kind of a similar look and feel, some new reskinning of the organization, but really helping us get that message to the people that are interacting with us. Finding services, prioritizing our ability to find the service they're looking for. Not when they just come to look at us. It's not a difficult way to find what they're looking for PHS. Immediately identifying what is the audience that we serve. We serve the population of children with medical complexities, and we want to bring them home. And that's what we do. And then so really followed with a more simple message to our families, our referral sources, and those employees that want to work with us, why they should interact with PHS, focusing on the ability to find the support that they need quickly, what states and what locations that they can see our services in. So the marketing team and marketing communications team have been working diligently over the course of the last several months to help us get to a more efficient website, to help us tell that specific story of our children are the center of our organization. We understand children with medical complexities, and it is our goal to bring them home. So be on the lookout for our new website there, and you can see across the top indications of our services, careers, our education, all those things that make PHS who we are is very important. Now, I shared with you the fact that we're number one and what makes us very unique and special in the organization or in the industry. And on the next slide here, I'd like to share with you some of the facts that we have about that. We did a survey, had a national study comparing us against national and regional competitors, large organizations, some that are very pediatric focused, some that are deep into multiple services, and we compared ourselves against them along 10 distinct measures, and 4 of the primaries are listed here. But we measured 10 specific questions about the types of questions that our referral sources have. We surveyed referral sources, and this is a referral source based survey. And in all 10 measures that we surveyed, PHS exceeded our competition in every single measure and against every single one of those primary national and regional competitors. So what you see on the slide here is the purple is our score. These are areas that are important to the referral source in making that decision. And when it says, it comes down to, is it important for your referral source to have a pediatric, for the referral source, excuse me, is it important for the referral source to have a provider that is specifically pediatric focused? They said yes, and they think of us 67% of the time, and our competitors 45% of the time. Comprehensive solution. PHS scored 56, our competition 47. Prior patient experience 67% versus 52, and this is the average of those. And there were some that we were significantly above. Patient and caregiver preferences. Other things we measured: timeliness, ease of use, our ability to provide multiple service offerings in one setting. And so every single category, we outpaced our competition. Now, that all boiled into another question set. How do you feel about PHS? You know, if they had experience with us, and some of them didn't, where do you grade them? And that then boils down into into what's called a Net Promoter Score. And that is a weighting against our competition. There are the number of people that really say we would promote PHS versus the detractors. We scored 17% higher than our competition, right? Not only that, we had the #1 Net Promoter Score amongst all of those other companies surveyed. So what does this mean? It means that we are providing the right answer for the referral sources. That when we come to the solution with our Pediatric Center of Excellence, that is providing the answer that they want. In essence, it's the easy button for them. We're pediatric focused, multiple disciplines, community integration, educational offerings, all those things that go into us being 33% higher. Ultimately, we're 17% higher on our Net Promoter Score. And in fact, ours was one of 2 Net Promoter Scores that were positive. And if you have a negative Net Promoter Score, it's a detractor, meaning say people would prefer not to refer to them. So what does this mean? We are industry leading on our Net Promoter Scores. We outpace the competition on all the reasons why people choose us, and it's an indication of the hard work that you do to provide that care to the children every single day. And we know that it's not just because it's convenient. We know it's the quality that we offer, the education we offer, the clinical service that we offer, all those things working together. So congratulations to you. You all deserve a standing ovation. Maybe we should put the entire company as a PSO for next month. But congratulations to you for having that Net Promoter Score and outpacing the competition. You should be proud of what we have. This is really a testament to you. So thank you to you. As part of that, I'd like to share a couple of case studies. And again, this is about bringing children home. And I've asked Christy Fell to highlight a couple of really unique and great success stories. One coming from the state of Texas, one coming from the state of Kansas, where we're bringing these children home. So Christy, I'll turn it to you.
Thank you, Adam. Good afternoon, everyone. I wanted to take a moment to introduce you to our Hospital to Home program. This program began many years ago as a way to assist families in that transition from the hospital or inpatient setting to bringing them home. We have 2 patients that we'd like to highlight today. This is Elena, and she was born prematurely, subsequently resulting in the need for mechanical ventilation, frequent sectioning, and nutritional support. Our Dallas PDN branch, along with help from the PHS DME team, brought her home on August 7th from Medical City all the way to Quinlan, Texas. She's a comprehensive care patient with DME, nutrition, respiratory, and nursing. So we were able to bring her home 100% staffed to help with that support and keep her at home with her family. Next, we have Ella May. So Ella's been on services with us since 2021, and she was a hospital to home patient from Children's Mercy in Kansas City, and we brought her home to Emporia, Kansas. She was initially mechanically ventilated, but has since graduated off the vent, but still requires nursing. And I also wanted to take this time to spotlight Nurse Mindy, who you will see in the pictures with Ella. Mindy joined us solely to bring Ella home from the hospital and had planned to exit once she was settled at home. And that was 3 years ago, but Mindy's still with us, but most importantly, she's still with Ella May. So big thanks for Mindy to everything she does for Ella and her family.
Thanks. Okay. Thank you, Christy, for those great stories. And as you know, as everybody on the calls knows, there's countless stories that we could put up for days. And so we appreciate the ability to highlight not only the patients, but also the stories that they represent, the different stories of these patients, the complex, the process of caring for pediatric complex pediatrics is unique to every single patient, and the stories are all different. And we appreciate the uniqueness of that and recognize that it is us working together that requires that you see the combination of service lines in both of those children's stories. So we're glad they're home. We're glad they're with their families. And we thank those nurses and respiratory therapists and all the different staff that are involved in their care. To continue on, just again, just some highlight as a reminder, we have over the course of time brought several organizations together to create our Pediatric Center of Excellence, to take that Pediatric Center of Excellence across the country in many states, now providing services in 17 states. Adding to that most recently our PPEC business, which allows us to take care of children during those daytime hours where their family may be at work, and allow them to have some group interaction and provide an efficient way to take care of children that with the staff we have. And so we appreciate the PPEC team joining the organization. That's Pediatric Health Choice here. But all of this is a reminder that we continue to seek out like-minded organizations to put them together within the model. And we know that that we have become an agency of choice where other like-minded organizations see what we do. They see our net promoter scores. They see the quality of services. They see that 33% better and say, we want to be just like them and we want to join that organization. So we'll continue to seek like-minded organizations and bring that to all medically complex kids across the country. So whether you're in San Antonio, as Drew said, or Covington or Columbus or Cleveland or Duluth or anywhere in between, we remind you of the benefit of working together and being better together for that. As we turn now to the efficiency section of our presentation, you're going to get an array of individuals to speak to us. We have some pieces that we'll hear from Chad and Joyce and Jorge and Chris as we talk through some of the things that we're doing as an organization to help live by that guiding principle of reduce the complexity, do what's efficient, and forget the rest, and which allows us to do what we do best, and that is take care of children at the bedside. So with that, I'll turn it over to Chad for a little discussion around our distribution partner.
Great. Thanks, Adam. You can go ahead to the next slide. So it's been a few months now since we launched Cardinal for a few of our locations, our Ohio locations, in Richardson location in Texas, and then all of our Florida locations. And over that time, we've been working with Cardinal to identify opportunities to improve. How are we fitting this across for those organizations? How are we going to think about it when it scales, et cetera? So we've been learning quite a bit and working with them quite closely through those launches at those locations. And we're now in the process of engaging all the other locations. And there's been some of you may be on some of the regular sessions where we're doing some planning for migrating the rest of the company towards late September to Cardinal as our distribution partner. Right now, there is a coordinated group that Amy Zuber is leading, but it's in collaboration with IT. We have marketing, communications, branch, operations, procurement, clinical quality, pretty much everybody there representing our organization and our patients to make sure that we know how we're going to do this transition and do it well for our patients for the rest of the country. Just want to remind folks, because some of you may have not been on the first time or be as close to what we're doing with Cardinal. So Cardinal that we work with is Cardinal Health at Home. They're solely focused on providing healthcare and supplies to people at their home, in their home, which is what PHS does. That's the group we work with, and that's their sole focus. They're a very patient-focused organization. A number of you, Adam and a few other leaders as well, have met with them, gone on site to some of their locations, and it's very clear that they match PHS in terms of how they think about patients and their mission in terms of serving patients, especially those at home through their Cardinal Health at Home group. So we do feel they're the right partner for us. While there were bumps along the road, we've identified and improved quite a few of things. Cardinal has come forth because of our scale and what we ask for and knowing what our patients need, have put forth things like specialized and dedicated transport for some of our logistics that's going to be occurring for Minnesota as well as for Texas, as well as adjusting and changing their website just for PHS for our staff and how we engage and how we want to be able to use the information. So as a partner, they've been exceptional. It's a good match us going forward. We expect the rest of the remaining groups to go, as I said, in late September. And I'm looking forward to working with each of you on that as we go forward. Before I leave, I'm just going to let the Milwaukee folks know that I will see you tomorrow morning for breakfast there, bright and early, and I'm looking forward to that. And now I'm going to hand it off to Joyce, who's going to cover a little bit about ACHC and what we're doing with them, what we did there.
Thank you, Chad. Appreciate it. Good afternoon, everyone. Going to be talking today about our ACHC accreditation. So 2024 marked the year that we were up for reaccreditation in our DME service lines, as well as pharmacy and infusion therapy. And so really happy to share that our surveys were a resounding success. So we underwent 17 on-site surveys across the organization. And of those, we had 20 on-site surveys with 17 plans of correction that were submitted and accepted. And so anytime that a surveyor comes out and finds an area of opportunity, they will give us a citing on that, and then we put together a plan of correction. And so I called a resounding success because the areas that they found were minor and did not necessarily affect patient care. So it was more of crossing our T's and dotting our I's, but wanted you to know that the surveyor shared at each and every site just how impressed she was with each site and the care that was provided. In fact, she made the statement that if she ever had a child that needed pediatric care, that she would come to PHS, which is a huge compliment to all of you and the work that you do every day. So we have our 3-year accreditation certificate, so we are good for another 3 years. That certainly doesn't mean that we take our eyes off of the standards and what's important. So for the next 3 years, as we're waiting our next survey, we'll be ensuring that our plans of correction are integrated into our processes. So make sure that we're doing the right thing every day. I always tell people every day should be an anticipated survey day because we want to stay survey ready. It's not about having a successful survey. It's making sure that the care that we're providing is the highest quality and within the standard. So thank you to everyone that was involved. Huge shout out to Carol and Bassford who helped lead this initiative. And for our nursing folks, get ready. We are going to be going through reaccreditation in 2025. So looking forward to that journey with you.
Thanks, Joyce. Jorge. Yep.
Thank you. Next, I would like to provide an update on the enterprise phone system consolidation project. I'll wait until we get caught up on the slides. Thank you. For those that are newer to PHS, we are working on an initiative to consolidate phone system solutions across the enterprise. We started back in April, and today we're launching in San Antonio. There are, for those, again, that don't know much about the solution, it is made up of two components. We have on one side Five9, which is a contact center solution used by patient-facing employees. And then on the other side, we have Microsoft Teams Voice, which is used by administrative and mobile clinical staff. Typically, phone system projects are not exciting, but this one is particularly exciting for two reasons. The first one being that it directly supports the three pillars in the PHS Way. Thanks to Five9, we have additional tools and metrics and reporting in real time that can help us track abandoned calls and proactively follow up on those calls, and therefore helping us bring more care to more kids. Secondly, thanks to the auto attendant, we can route calls automatically to the people that have the skills to address the call. That results in fewer transfers and more efficient processes. And then lastly, not having the phone ring for everyone at the same time or feeling like calls are not being distributed evenly, that also supports making it a great place to work. If we can go over to the next slide, please. Thank you. And then the second exciting thing about this project is the feedback that we've been hearing from every place that we've implemented. I just picked a few here. But what is really neat about this solution is that more than a phone system, we're looking at a tool that is helping us improve processes and the overall experience, not only for agents, also for patient families and for referral sources. So a lot of these are additional benefits that we didn't think of right away, but as you can see, great acceptance, lots of feedback. Typically, the day prior or the weeks prior to go live, people are a little bit stressed out about the change, but that changes on day 2, 3 of the solution. People are really excited. That's what we've seen so far. With that, we've completed 5 implementations. We have 6 more to go. The next sites will be Kansas City in September, the Upper Midwest in October, and lastly, the Waco location in October. And I will turn it over to Chris.
Thank you, Jorge.
Thank you.
Can we go next slide? Okay. Cybersecurity continues to be a top priority for us in the organization and other organizations around the world. And cybersecurity is important because it allows us to protect not only our client data, our company assets, and maintain that public trust with our clients and other vendors and everyone that we work with. Some of the highlights that we've seen over recently, and this is one thing I want to just kind of stress, is on a daily basis, we see an average 326 phishing emails come through. These are not ones that are initiated by testing. These are just regular phishing emails that are coming in from malicious actors. In those emails, there's usually about 17 variants of different malware that we see, as well as jumbled in with about 4,000 spam messages a day. One of the great things about this is our systems are able to identify a majority of these and block them automatically so that you never see them. They never come through to you. With phishing email, though, it still remains that 97% of all cyber attacks begin with a phishing email. And one of the great things that we've been doing over the last year is just kind of stressing that importance. And we've actually brought down our phish prone score from down to 2.8% as of the last test, which was in the last week. That is, as you can see, about 3% lower than the industry average. So great job, everybody, watching out for those phishing emails, reporting them when you see them. I love seeing them come through, even if they're not valid. At least let me know that everybody's watching them and watching what they're going on. Some of the most common factors that we see when people are clicking on phishing emails is the subject lines. They typically almost always have something to do with annual reviews, paycheck, payments due, invoice past due, or human resources of some time. Those are the number one areas that people fail, and they click on those phishing emails. So just keep an eye on those. On the right-hand side here in the bottom right, I listed just a few companies just this last week that were attacked through ransomware. Remember, 97% of those came from a phishing email. And going forward, we're going to continue to improve spam and phishing filtering, and even maybe get down to the point of maybe filter a little bit of the gray mail that people receive. And gray mail is just an email that comes through that you've selected for, you've received, or maybe it's a vendor that sends you just unsolicited, just emails occasionally, and you just want to kind of filter those out of your inbox. We're looking at a way to kind of filter that down to make it where we're only seeing the stuff that we want to see. That's pretty much all I have for today. Thank you again, everybody, for all the work that you're doing to help keep the organization safe. Remember, if you see something, say something. Thank you.
Thank you, Chris. If there's ever an individual to make you suspicious of an email, it's Chris, right? When I get these emails that come across from people I don't know or that I don't ask. I mean, I am trying to report as often as I can, and I know I don't report them all, but this is an important topic, obviously, with the things like Change Healthcare happening in our industry. It's very, very important. So please continue to be vigilant on this. I know I appreciate it when you reach out to me and somebody will send me a text. Did you just send me a random text that said that they need to talk to me? Didn't recognize your number. Thank you for reaching out. The answer is I probably didn't. So thank you for that, Chris. Great heads up, and we'll continue to be stalwart there. So next pillar of ours is be a great place to work. And we'll turn over to Leanne and team for a lion's share of this. But the first slide I'd like to share with you is actually some new news that just got released yesterday. So if you could turn to the next slide, for the third year running, PHS has joined the ranks of the top fastest growing companies private companies in America. And specifically in the healthcare industry as well, we are on the ranks of that as well. So what this says is we are bringing that more care to more children. We are appreciative of our investors that allow us to do this. We're appreciative of all those individuals in the organization that continue to take forward that mission of bringing children home and letting them thrive in the place they call home. So 3 years of continuous growth in this way is a representation of all that you do. And again, going back to those referral sources want more of us. So again, congratulations. We'll continue to celebrate this through each of the organizations. But one of the things that we've done in the last little bit here, and that I'd asked Leanne to share with you, and I think it's important that you see the results. We don't survey you just to survey you. We survey you because we want to know. We recently did our engagement survey, and thank you to all those respondents. I won't share all the details. I'll leave the thunder for Leanne. But suffice to say, it's important for us to know what's going well, what are some opportunities for us to work on. That's the information we gather from that meeting. So I'll turn it over to Leanne to share with you our comparison against last year and some learnings that we had.
Thanks, Adam. Hey, everybody. So excited to focus today, as Adam said, on the employee engagement survey results. And I want to start with an overview of the results for the enterprise support services, RT, clinical nutrition, and IV. First, as Adam said, thank you. Your participation and feedback is valued and appreciated. So your contributions are important in this process, and we'll talk a little bit more about that in a bit. So we saw overall strong results year over year. And in fact, overall for each category within our survey this year, and same areas as last year, we saw an increase over last year and over the last 2 years. So that was really great to see, and to see that as we're working locally on employee engagement, that it's resonating with you in the field. One of the key indicators that was included in this is the opportunity. When you say I have the opportunity to do what I do best every year, which is a key indicator of engagement, and that has continued to go up as well. Next slide, please. I want to highlight a few of the results from this survey. So as you saw, the number of participants has increased, and that's because we've added a large number of team members that had the opportunity to take the survey across the country this year. Our overall results are up over 3% over the last 3 years. The tools that you have and equipment that you have to do your job has increased in satisfaction by 6%. Our happiness indicator continues to go up, and up over 5%. This is a question we started asking last year with our engagement survey and continue to ask month over month with our pulse surveys that you see. So the moment in time, I'm happy at work today. And we're really encouraged by the continued increase in that happiness index, as well as you feeling safe to be your authentic self as work, which continues to have a strong increase as well. A key area for continuous improvement is that opportunities that you have available to you to learn and grow at PHS. It's going to continue to be a focus in the second half of this year, as well as our strategic planning process. We think about how we continue to provide those opportunities and make them more visible to you as we look at 2025 planning. Next slide, please. So the things that you love about working at PHS, these are very similar to what you said last year. Our mission is at the core of, what you care about, and as well as those families and the patients that we're serving, and then your connectedness to your team and your coworkers. 85% of you also agreed or strongly agreed that your manager is an effective leader, which really is a testament not only to the way your manager engages with you, but how you engage with your manager and with each other as a team. Opportunities for continuous improvement, communication and transparency, we see that frequently. And you're going to hear from Emily Youngren in a few minutes here that's going to look at one of the new opportunities from a transparency and communication perspective for employees, as well as connected to visibility to growth opportunities. We are also a growing company, which is exciting in so many ways, and it creates opportunities for us to think about how we manage change and look at market consistencies and efficiencies. So as you meet locally with your leaders and your teams, share your ideas on these opportunities and what we can do together as a team to improve. Next slide. We also did HCN PDN survey separately, and this was the first survey that has been done collectively across all of our nurses across the country. So you can see again what nurses in the field love about PHS is that caring for the kids, the communication and the support that they are receiving. And we heard feedback after feedback, so many comments and appreciation about the leadership team for the field staff, as well as their local office staff and support. So kudos for that. And then of course the PHS mission is very compelling and connected to what we do organizationally. Opportunities, communication pops up on that side too, and it's not a surprise to us. There's always opportunities for that continuous improvement. So what's next really is your local conversations that you have. Also, one other thing I want to say about the nursing is that I know the leadership team for nurses are planning their branch administrator meeting in early October, and these results will be shared with the branch administrators, and there'll be some planning around projects and action plans from a nursing service line perspective as well. So local conversations are next, and the pulse surveys are continuing throughout the year. The first one kicked off in August here. So again, I want to say thank you again for your participation. Your voice is important, and your contributions that you provide give us valuable feedback as leaders for what we can do to continue to strive to make this a great place to work. So I'm going to pass it on to Emily.
You can go to the next slide. All right. So yes, like Leanne mentioned, as a part of our employee engagement survey, one of the key requests from employees is the implementation of an internal job board to help support their career development and provide a greater access to growth opportunities within our organization. So we are excited to launch our new internal job board. So what does this mean for you all? You will now have access to Clear Company. You will be able to sign in through single sign-on, and this is where you are able to view all of our career opportunities across the company, filter by department and or location. This will create a streamlined hiring process as recruiters will receive an instant notification when an internal employee applies. We've also introduced a new quick apply feature, which will make the application process faster for employees. It should take less than 2 to 3 minutes for an internal application to be completed. And lastly, a new way to refer a friend. So through this, directly through our internal job board, you'll simply be able to click to refer a friend on the jobs on the detailed job page. You'll be able to add your friend's name and their email address, and that job will automatically get sent to their email address or to their email. And if they apply, your name will automatically be included on that application. This will ensure that you're eligible for the referral bonus if they end up being hired. A few quick things to note. Please remember, if you are applying for a new role, ensure that you've been in your current position for at least 12 months and discuss with your current manager before applying. We also want to highlight that we do offer referral bonuses for all roles, so it's a great opportunity to help us find new talent and earning a reward for yourself as well. So more information will be coming on this next week. I will be giving a more detailed summary in the huddles. There will be an all staff communication on how to access Clear Company. We will have a resource page available on the hub and posters around each office. And of course, if you have any questions at all, please reach out to the HR team and someone will be able to assist you. I'm going to hand it over to Crystal.
Thanks, Emily. All right. Well, we are already at our Q3 event for 2024, which seems a little crazy. Breakfast with the bosses happening across locations throughout the month of August. Great Plains, HCN and PDN leaders will be connecting with employees for their breakfast out in the field, whether that's in a patient home or connecting for lunch, or another way for them to connect with the field staff, since they're not in the specific location at all times. So thank you for doing that, those GPL culture champions and leaders. We're doing a little twist on Breakfast with the Bosses this year for a chunk of our locations, 14, and I think we might be adding maybe one more, 15 PHS offices will have an enterprise senior leader attending live at their breakfast. You can see the table of all of those locations in the next 2 weeks happening here. Lots of breakfast happening tomorrow, as you can see. So hopefully some good eats happening tomorrow. I do want to mention, along with maybe seeing a new face and leaders meeting maybe some new faces at those locations that they don't necessarily travel to often, we do want this to be a really nice, engaging time. Senior leaders will be armed with some information that Leanne actually discussed a little bit about the engagement surveys for the region, and just doing a little listening session with staff at those breakfasts as well. So come and enjoy some food with your senior leaders, and hopefully a great listening session as well. Thanks again to all culture champions, as always, for hard work for putting these events together for everyone here. So thanks, and I think I will turn it back to Adam.
Sure. Thank you, Crystal. And again, I appreciate all the culture champions putting together some effort for us to be with you all in the coming days. And we do appreciate the opportunity to come see you. And we're happy that multiple senior leaders in the organization are able to be in the locations. And we recognize there's different ways for us to interact with you. And so this is a fun way to do that. And everybody should get to know Lee there, who's serving pancakes from last year. So that's what we're going to be doing. Let's have some breakfast with you and sit down and talk. So we can turn to the last slide, which is simply an opportunity to say thank you. I appreciate all of you just spending time with us today. Any questions that you have, feel free to filter them up to your senior leader or in the organization, and we'll bring those together. We'll get them answered. We'll have a chance to sit with you during the breakfast with the bosses. And most importantly, thank you for all the work that you do every day to take care of the kids, take care of each other's, be a good group of individuals working together to carry out the mission of the organization. We appreciate all you do. And again, thank you. Have a great day. We look forward to speaking with you again very, very soon.